you're losing muscle right now. While you're watching this, after 60, you lose 8% of your leg muscle every decade. That's why stairs feel harder. That's why your legs feel heavy. That's why you're tired after walking. But three specific nutrients, when your body gets the right levels at night, can reverse this in 21 days. Not help a little, reverse it. Robert Anderson, 72 years old. Couldn't walk to his mailbox without resting. Got his levels tested, worked with his doctor on the right protocol. 21 days later, walked 2 miles without stopping. I'm Dr. Akio Matsumoto. I've been treating muscle loss in seniors for over 40 years, and what I'm about to show you works fast when done correctly with your doctor's guidance. But these nutrients need to be taken at night, not morning, night. I'll explain why in a minute. 3 nutrients, blood test to confirm deficiency, taken before bed with your doctor's supervision. That's the protocol that saved Robert's legs. Stay with me, because in the next 10 minutes, you're going to learn exactly which nutrients, why blood tests are critical, and how to work with your doctor on this. Let's start with Robert's story. Robert came to my office 6 months ago, 72 years old, former construction worker, strong his whole life, but something changed at 68. His legs started getting weaker, fast. Walking to mailbox equals exhausting. Climbing stairs equals had to stop halfway. Standing up from chair equals needed to push with arms. Playing with grandkids equals impossible. He went to 3 doctors. They all said the same thing. It's sarcopenia, muscle loss. It's normal at your age. Try to exercise more. But Robert couldn't exercise more. He was too weak. His legs wouldn't hold him. When he came to me, I did something those other doctors didn't do. I ran a comprehensive blood panel, specifically testing for 3 nutrients critical for muscle function: vitamin D levels, magnesium levels, vitamin B12 levels. The results shocked me. All 3 were well below the optimal range for muscle health. His body was starving for these nutrients, and without them, his muscles were literally wasting away. But here's what most doctors don't know. These nutrients work best when taken at night. Why? Because muscle repair happens during deep sleep. If your body doesn't have what it needs during those critical nighttime hours, your muscles can't rebuild. I worked with Robert to create a personalized supplement protocol based on his blood test results and his health conditions. We addressed each deficiency appropriately, all 3 nutrients, every night, taken before sleep, under medical supervision. Week 1, he noticed his sleep improved, deeper, more restorative. Week 2, his legs felt less heavy in the mornings. Week 3, he walked to his mailbox and back without needing to rest. 6 months later, he's walking 2 miles, playing with his grandkids, living his life. His leg strength came back. Not all of it. You can't reverse 40 years of aging, but enough to matter, enough to live independently. And it started with identifying those 3 deficiencies and correcting them properly with his doctor's help. Now let me call Robert. He's going to tell you something specific, what he felt during those first 3 weeks, because you need to know what to expect.
Dr. Matsumoto, hey there.
Robert, thanks for joining. Tell everyone, what did you feel in the first week? Be specific.
Okay, so everyone listening, I'm Robert Anderson, 72 years old. 6 months ago, I thought my active life was over. Today, I walked 2 miles this morning before breakfast. Here's what I felt week by week after getting my deficiencies corrected. Week 1. The first thing I noticed wasn't my legs. It was my sleep. I started sleeping deeper than I had in years, like I wasn't waking up 3 times to pee. I was actually sleeping through the night, and when I woke up, I wasn't as stiff. Usually, I'd have to sit on the edge of the bed for 5 minutes before I could stand. That went away. Week 2. My legs started feeling different. Not stronger yet, but less dead. Does that make sense? Like, usually my legs felt like lead weights. Heavy, dragging. But in week 2, they felt more responsive. I could stand up from a chair without pushing so hard with my arms. Week 3. This is when I knew something real was happening. I walked to my mailbox, about 100 yards from my house. Usually, I'd have to stop halfway, lean against a tree, catch my breath. But week 3, I walked there and back without stopping. My wife saw me and said, "Robert, you're walking faster." Month 2. I started taking short walks around my neighborhood. Just 10 minutes at first, then 15, then 20. My legs weren't burning out like before. They had endurance. Month 4. I walked a full mile. Sounds small, but I hadn't done that in 5 years. Month 6. 2 miles this morning. 2 miles. Look, I'm not running marathons. I'm not back to being 40, but I'm functional again. I can play with my grandkids without my legs giving out. I can go grocery shopping without needing to sit down halfway through. I can live. And it started with getting tested and working with Dr. Matsumoto to correct my deficiencies. That's it. If your legs are getting weaker, if stairs are hard, if you're tired after walking short distances, get your levels checked. Talk to your doctor about these 3 nutrients. Don't wait. I waited too long. Don't be like me.
Perfect, Robert. That timeline is exactly what people need to hear. Thank you.
Thank you, doctor. You gave me my legs back.
Now, let me explain exactly why these 3 nutrients are critical and why you must work with your doctor to get the right levels. Your leg muscles are made of protein fibers. After 60, your body breaks down these fibers faster than it rebuilds them. That's sarcopenia. But here's what most doctors don't tell you. The breakdown is not inevitable. It's usually caused by 3 specific nutritional deficiencies. Let me show you. Nutrient number 1, vitamin D, the muscle builder. What it does, vitamin D activates muscle protein synthesis. Without adequate levels, your muscles literally can't build new fibers, even if you exercise. Why most seniors are deficient? Skin produces 75% less vitamin D after age 65. Sunscreen blocks D production. Winter months equals almost zero production. Most foods have very little D. The nighttime advantage. Vitamin D works with growth hormone during deep sleep. Growth hormone peaks between 11 p.m. and 2 a.m. When you have adequate D levels at night, it's ready when growth hormone arrives. Research shows seniors with optimal vitamin D levels have 40% less muscle loss. Correcting deficiency improves muscle strength within 3 to 4 weeks. Optimal levels vary by individual. Blood testing is essential. Critical. Never guess your vitamin D needs. Get a 25-hydroxy vitamin D blood test. Your doctor will determine the right approach for your body based on your levels, your weight, and your health conditions. Nutrient number 2, magnesium. The muscle, relaxer and rebuilder. What it does, magnesium is involved in over 300 enzymatic reactions in muscle tissue. It's required for muscle contraction and relaxation, protein synthesis, energy production in muscle cells, preventing muscle cramps and spasms. Why most seniors are deficient, aging kidneys retain 30% less magnesium. Many medications deplete magnesium, diuretics, PPIs, metformin. Modern soil equals food has 50% less magnesium than 50 years ago. The nighttime advantage, magnesium activates your parasympathetic nervous system, your rest and repair mode. It also improves deep sleep quality. Deep sleep is when muscle repair happens. Research shows seniors with low magnesium have 2.5 times higher risk of muscle weakness. Correcting deficiency increases muscle strength significantly, improves sleep quality by up to 37%. Magnesium supplementation requires medical supervision, especially if you have kidney issues or take certain medications. Your doctor will test your levels and determine what's safe for you. Nutrient number 3, vitamin B12, the nerve and muscle protector. What it does, B12 is essential for nerve function. Your nerves tell your muscles to contract. Without adequate B12, The nerve signals weaken. Your muscles stop responding properly, even if they're not physically weak. B12 also helps produce red blood cells, which carry oxygen to muscles. No oxygen equals no energy equals weak muscles. Why most seniors are deficient. Stomach acid decreases with age. You need acid to absorb B12 by 60. Up to 40% of people can't absorb B12 from food properly. Medications like metformin and PPIs block B12 absorption. The nighttime advantage. B12 helps regulate your circadian rhythm and improve sleep quality. Better sleep equals better muscle repair. Research shows seniors with low B12 have 2 times higher risk of mobility problems. Correcting deficiency improves muscle strength and balance, reduces risk of falls by up to 30%. B12 deficiency can mimic serious neurological conditions. You need proper testing and medical supervision to address this safely and effectively. When corrected to optimal levels and taken before bed, they create a synergistic effect. They don't just add up, they multiply each other's effectiveness. Here's the exact protocol I use with my patients over 60 with weak legs. The doctor supervised leg strength. Protocol Step 1. Get tested. This is not optional. Schedule an appointment with your doctor and request these specific blood tests. 25 hydroxyvitamin D test, not just vitamin D. Serum magnesium test, not the same as standard. Metabolic panel, vitamin B. 12 test, ideally with methylmalonic acid for accuracy. Why testing is critical? You might not be deficient in all three. Your deficiency severity determines your approach. Some people have absorption issues that require different forms. Without testing, you're guessing, and guessing can be dangerous. Step 2. Review results with your doctor. Your doctor will interpret your results in the context of your current medications. Many interact with these nutrients, your health conditions, kidney issues, heart conditions, etc. Your age and weight, other factors unique to you. Your doctor will then determine which nutrients you actually need. What forms are best for you? Some people absorb certain forms better. What approach is safe given your health profile? How to monitor your progress. Step 3. Follow your personalized protocol timing. Generally, most protocols involve taking these nutrients before bed because your body enters deep sleep around 11 p.m. to 2 a.m. growth hormone peaks during this window. These nutrients are available when your body starts muscle repair, but your doctor might recommend different timing based on your specific situation. Step 4. Get retested after 8 to 12 weeks. Get retested to confirm your levels are improving. You're not over-supplementing. The protocol is working for you. Step 5. Be consistent and patient. Week 1 to 2. You'll likely notice better sleep first. Don't stop. Muscle changes are coming. Week 3 to 4. Your legs will start feeling less heavy. Stairs get easier. Month 2 to 3. Noticeable strength improvements. Walking feels easier. Month 6, significant strength gains. You'll be doing things you couldn't do months ago. Never start supplements without medical supervision. These nutrients can interact with medications. Too much can be harmful, especially vitamin D and magnesium. You might have conditions that make supplementation dangerous. Individual needs vary dramatically. Look, I've seen hundreds of seniors reverse their muscle loss with this approach when done correctly under medical supervision. But I've also seen people hurt themselves by self-prescribing supplements without testing or medical guidance. Don't be that person. Your doctor is your partner in this. Work with them, not around them. The question isn't whether optimizing these nutrients works. It does. The question is, are you going to do it safely? If this video showed you a path forward for your weak legs, hit that subscribe button right now. Because every week I'm sharing protocols like this, real medical approaches that work when done correctly. Click subscribe, turn on notifications, And share this with someone who's struggling with weak legs and doesn't know where to start. Your legs don't have to keep getting weaker. Muscle loss after 60 is not inevitable, but you need to approach this intelligently with testing, with medical supervision, with patience. Work with your doctor, get tested, address what your body actually needs. Don't guess. Don't self prescribe. Don't skip the medical supervision. Do it right and watch what happens. I'm Dr. Matsumoto. Stay safe, stay strong, and I'll see you in the next video.